Good evening, dear Medyascope viewers. Welcome to This Week in Turkey. Today is May 1st, International Workers' Day. Due to the pandemic this year, the 1st of May was celebrated differently. Today, there's also an official curfew in 31 provinces around Turkey. Thus, May Day celebrations have been conducted in a symbolic fashion. The Istanbul May Day platform, consisting of unions, political parties, and labor organizations, had a symbolic commemoration ceremony in Taksim's Kazancı Hill to remember the victims of the 1977 attack. A second ceremony was held in Şişhane to commemorate Mehmet Akif Dalcı, who was killed on May Day in 1989. Other unions celebrated symbolically via social media. The Confederation of Progressive Trade Unions of Turkey did attempt to walk to Taksim Square this morning. However, DİSK chair Arzu Çerkezoğlu and 25 others have been taken into custody by the police in front of the DİSK central office in the Şişli district of Istanbul. This week, our guest will be Dr. Esin Şenol. Dr. Şenol is a professor of medicine and an infectious diseases specialist, and we will be talking about the 4C normalization process and what to expect from the new normal after the pandemic. First, let's take a look at this week's developments. As of April 30th, the death toll from the coronavirus in Turkey has reached 3,174, with the total number of positive cases at 120,204.
On April 29th, Health Minister Fahrettin Koca said the outbreak had reached its peak in Turkey and the rate of rise in cases has been seeing a downward trend. Koca, however, also warned that a second wave of infections might arise if citizens did not abide by the measures and isolation rules. The minister also revealed that 7,428 medical staff personnel have been infected with the virus. This figure, he said, corresponded to 6.5% of all cases. Koca also informed reporters and the public that the Coronavirus Science Committee and all relevant ministries were currently in talks to finalize the timeline of the gradual normalization process. President Erdogan also stated that a schedule for returning to normal would soon be announced. Erdogan said that Turkey will continue implementing weekend curfews in 31 provinces until after Ramadan in late May, at which point normalization is aimed in order to revive the economy. The fourth consecutive curfew is taking place between May 1st and 3rd. On April 3rd, face masks became mandatory in public spaces. The government had announced that the sale of masks was prohibited, and they were going to conduct the distribution themselves, wherein individuals would receive a code with which they could pick up their masks from the pharmacy. Due to the intensive demand for masks at pharmacies, a new regulation regarding the distribution of masks was announced. According to the new regulation, individuals working for public institutions and those benefiting from social insurance will receive their masks from their workplaces. This new regulation aims to decrease the workload of pharmacies from 40%. However, no information was provided regarding those individuals working from home. Further, the Confederation of Turkish Trade Unions and the Confederation of Public Employees Unions have stated that they were not informed as to how these masks would be distributed and how workplaces would procure the masks.
This evening, we have Dr. Esin Şenol with us. Dr. Şenol is a professor of medicine and an infectious diseases specialist working at the Faculty of Medicine of Gazi University in Turkey's capital, Ankara. Good evening, Dr. Şenol. Thank you so much for being with us this evening.
Good evening. It's good to be with you.
So, Dr. Şenol, I'd like to start by asking you about the masks. As you know, masks are mandatory to wear in public spaces nowadays in Turkey. However, there's been some, mix-up regarding how to obtain these masks. So many people have still not been able to get their masks despite new regulations to make people access them. So first of all, medically speaking, how effective are masks in protecting us from contamination, and how often should they be used and how often should they be changed?
As you all know, World Health Organization, who has just changed their guidance regarding the use of masks in the community, because it was discovered that people without having disease symptoms were effective in transmitting the virus in the community. So they just recommended that in communities where transmission is high level, every people going into the community, going outside, would wear masks. And then all the scientific communities also suggested this for the communities with high-level transmission, but we were all knowing and concerned about the fact that the mask supply would be a problem afterwards, because if you just think about the number of people who should obey this recommendation, you just got millions of masks every day. So how should you supply these millions of masks every day to the people going outside because they have to go outside in order to work, in order to be in the workplaces? So we were concerned about the fact already, and then it became like a chaos getting the masks and using them in the proper way. Masks are working by blocking the virus from inside to outside. They are blocking the virus of the infected people. And when you cannot control getting the social distance in the if you cannot control the social distance in the community, so you should wear mask, but you have to use it properly. Whenever it gets damp, you should just change it, and you cannot reuse a single surgical mask. So it is not more than like half an hour, or at the most it should be like 2 hours, and you have to use and discard it in the proper way, because they are medical wastes at the same time, and it can get the source of infection for yourself and for the community if you cannot use it properly. So we have several difficulties in using masks, especially in our community, because we are not used to it like Asian communities. This is the part of their culture, but this is very new for us. So I think it should be implemented in a more proper way. For example, you should give the masks just at the entrances of the markets, groceries, and public transportations, and you should make the people discard them in the proper way at the exit of these places, and you should use widespread public spots in order to teach the people how to use them, how to discard them. But we just suggested everyone to use them in order to be on the safe side, but it had become a chaos for now.
Mm-hmm. Yes, Dr. Şenol, you mentioned that there's indeed a supply problem, and surely in this situation, medical personnel are a priority in terms of getting the available masks, as well as, workers in supermarkets or cargo workers, people, as you said, who are obliged to be outside and obliged to go to work. Yet we are sending aid around the world with the knowledge that in Turkey, medical personnel are still not as well equipped as they should be. So could you perhaps tell us about the working conditions of medical personnel in coronavirus wards here?
Yes, I'm working in a tertiary academic center just in the capital of Turkey. So I'm not having any difficulties in the supply of these personal protective equipments. But as far as I know, in the rural parts of Turkey, primary care physicians and people working at small hospitals are having difficulties in getting to supplies. So after the beginning of the epidemic in Turkey, they just supplied more and more. As far as I know, it's not the problem right now, but we are just in the midst of the pandemic. So it could be in future, in near future, because we didn't get over it yet. We are just in the midst of somewhere in the midst of pandemic, so we still need these supplies, and we still need to conserve them for the utmost need, I mean.
Mm-hmm. So many European countries at the moment are talking about the procedural loosening of the lockdown measures.
Yep.
Yeah, so a new kind of normal is being anticipated and steps are being taken for this. President Erdogan also signaled that Turkey will soon be announcing the plan for normalization, and it's predicted for the end of May. So do you think this is too soon, especially considering that Turkey only announced weekend lockdowns and did not implement it over an extended period of time? What are the risks of loosening precautions too soon?
I think it's too soon because we are just seeing the flattening of the curve.
Mm-hmm.
We didn't crash the curve yet. So we didn't implement all the stringent procedures to crash the curve yet. Turkey has just implemented several combinations of mitigation measures. It was kind of a hybrid measures.
Mm-hmm.
So we don't know what kind of measures worked till now and what kind of measures did not work till now. So we have to take the photo of the situation, what we have done till now.
Mm-hmm.
We have to securely see the whole position. What is the situation right now? How many people are infected, or how many people are prone to be infected? And then we should lose the measures in a procedural way. Otherwise, we will see another big, sharp, shocking wave. We are concerned of that. So loosening the measures is harder than implementing the measures. So we should be very careful about doing this.
Mm-hmm. Do you have any other concerns other than potentially contracting the virus? Are there side effects to being locked down? Does the lack of exposition to the outside world affect the immune system in any way?
Yeah, it is. We already know that this is an old historical method. I mean, locking down the cities, locking down the people is an old historical way. We don't prefer if we do have other implementations at our hands, but we don't have anything for defeating this virus, for defeating that fast pandemic. So this is the only and effective way of containment of the pandemic. Mm-hmm. So it's kind of very hard. I mean, it has lots of impacts on psychology and physiology of human being, especially for the fragile groups. So yeah, they have.
Dr. Şenol, you had already mentioned it earlier, but Turkey and Turkish representatives have been insistent on the success in the fight against the coronavirus. Every evening, the statements highlight the number of recovered patients, which is great, yet the positive cases and the death toll are pushed into the background. Also, the numbers that are given are being contested by medical associations. So do you think this attitude is responsible? Will it make the population feel like the danger is over? For example, I even noticed in my neighborhood an increase in circulation, and the Istanbul Metropolitan Municipality also said that there was an increase in circulation this week. So how do you assess the message given by the attitude of the responsible ministers?
I would just like to say that we didn't crash the curve. Once more, I just want to mention this once more. We didn't crash the curve yet. We are just seeing the flattening of the curve, and it is just the beginning of the flattening of the curve. So I just like saying that we are trying to build the plane while we are flying it. we are just in the plane right now, and we didn't land yet, but we are just seeing that we could land in several months. So we should be very cautious about this situation. It's a very fragile situation. So false alarms would make people loosen the voluntary isolation because they got bored to it, and they just frozen their social and economical lives, which is not easy. So they are so willing to lose everything at once, but it should be very wrong. I think I am concerned that we have widespread community transmission right now. We have hundreds of thousands of infected people. It is and just the tip of the iceberg. We do all know that we have several more cases in the community right now. So it would be very, dangerous to take these false alarms and lose every measurement that we just have implemented, and we didn't know the results of these implementations right now. For example, we closed the schools, but we don't know the impact of closing schools for flattening this curve. And if we just open the schools right now without knowing that how many kids are infected in my community, it would cause a very big, sharp, and catastrophic wave. I'm just concerned about it.
Mm-hmm. And in terms of the health system, what has happened to other patients, Dr. Şenol? In terms of hospital capacities and so forth, how have other critical patients in Turkey been affected?
They are just waiting their turn, I assume. They are staying at home right now. They are concerned about coming to hospitals because they don't want to contract to the virus. They don't want to contract to the disease right now. But how long they can be staying away from the hospitals? I mean, the people with chronic health conditions. I mean, the fragile populations who need therapies at once. How long they can wait at their places, we don't know. But in hospitals, there's now preparation for opening the other wards right now, and it would be step by step opened till the end of May, I assume.
Mm-hmm. So it has been foreseen that the coronavirus will come back in waves. So there's going to be a second and third wave. What do you foresee for the next couple of months?
First of all, this between 1 and 3 months time, I mean the summer, I'm saying this, the corona summer would be closely monitored for the whole time, because we should get the results of the implementations, and we should see the results of the implementations, how many of them are working and how many of them are not working. So we should lose some of them. We should implement some more of them. This should be a very careful observing and monitoring time. Otherwise, we cannot just lose and leave everything to the community. Otherwise, it would be again, the waves will come again. So we should be very careful monitoring the situation, very close monitorization of the situation.
So how do you foresee our new normal then, especially in the meantime while we await a potential vaccine?
I'm very hopeful about the potential vaccine. First of all, I have to say about it, at least I have more than some hope. It would be ready like the beginning of the 2021, but next year, I mean. But I have to say that the next 3 to 6 months, nothing would be normal regarding the old normal. We have to be prepared to a new normal. We should be moving. We should be lifting up some of the frozen social lives and economic restrictions, but it should be step by step, like a baby trying to walk, like a creeping baby trying to walk. But nothing should be as normal as the old definition of normal. But we should not be worried about it, I think, because everything will be step by step opened in a safe way, and probably the new normal would be better than the old normal. We should think about it. We should be hopeful about it.
Dr. Esin Şenol, thank you so much for your positive ending note and your assessment and insights regarding the current measures being taken. Thank you so much.
Thank you. It was good to be with you. Thank you.
Good to have you. Thanks. Turkey's Religious Affairs Directorate head, Ali Erbaş, has targeted LGBTI community and HIV-positive individuals during a sermon where he said, homosexuality causes diseases and decays lineage.
Islam accepts adultery as one of the biggest sins. It curses homosexuality because it causes diseases and decay to lineage. Let's come and fight together to protect people from this kind of evil, Erbaş said in his sermon marking the first day of Ramadan on April 24th. On April 27th, President Erdogan threw his support behind Erbaş, saying, "An attack on our Diyanet head is an attack on the state." The Ankara Bar Association condemned Erbaş and his mindset, stating that his statement incited people to hate and enmity. What we are surprised about is the dare of this individual, whose voice is archaic, in inciting hate and enmity via building his discourse on values deemed holy as he occupies a state institution, the bar said. The bar pointed out the fact that Erbaş gets his salary in exchange for remaining silent in the face of sexual abuse of children and trying to legitimize violence against women on religious grounds. Both the Ankara Bar Association and Human Rights Association filed a criminal complaint against Erbaş. Following the statement, Ankara's Chief Public Prosecutor's Office launched an investigation into the bar over insulting religious values. Other rights organizations, politicians, and bar associations slammed Erbaş for committing a hate crime. The Positive Living Association, a non-governmental organization advocating the rights of individuals living with HIV, has urged Erbaş to apologize for his remarks targeting the LGBT community and HIV-positive individuals, reminding him that the directorate was a member of the National AIDS Commission. Saying that Erbaş's statements contradict logic, science, and law, the association noted that he propagated hate speech in society. Despite his blatant call for hate crimes and hate speech, Erbaş received massive support from AKP officials. A hashtag saying Ali Erbaş is not alone was widely shared on social media, with government officials using it as well. Justice Minister Abdülhamit Gül, Presidential Communications Director Fahrettin Altun, Family and Social Policies Minister Zehra Zümrüt Selçuk, and AKP Deputy Leader Mahir Ünal were among the officials throwing their support behind Erbaş. Further, echoing the statement made by Erbaş, a Turkish heart surgeon, Metin Çakır, has been dismissed from the Helios Clinic in the German city of Karlsruhe after saying homosexuality is a disease.
19-year-old Syrian refugee Ali Al-Hamman was shot dead by a police officer in the Seyhan district of Adana in southern Turkey on April 27. Contradicting the initial reports, details of Hamman's death and what transpired are coming forward.
Hamman was wandering around the Kocavezir Trade Center with two friends. They came face to face with police officers who were conducting their routine controls. Hamman, who was under the age of 20 and thus under forced curfew, did not want to give his ID to the police. Sources who spoke to Medyascope stated that the police officers intimidated Hamman. Unlike reports stating that Hamman was running away from the police, sources said that Hamman was shot in his groin and chest from a 3-meter distance. Hamman died on the spot. Further, reports stating that Hamman was working in a textile factory and that he was on a break when he got shot by the police have been falsified. According to the meeting held by a lawyer from the Adana bar with witnesses and the family, the young Syrian had been unemployed for a long time. The Adana governorship had stated that the police officer who shot Hamman was suspended from his duties and arrested for premeditated murder. According to the testimony, the police officer in question said, "I was fasting. The neighborhood is unsafe, so we keep the safety catch of our guns off. When I was running after the suspect, I tripped and fell. That's when the gun was fired." Witness statements say that the police officer did not fall and trip.
That's all from This Week in Turkey. See you next Friday at 8 p.m. Good night.